everyone. I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is February 4th, and we're here for our weekly COVID-19 update. I'm here with Bob and Dr. C. Do you all want to introduce yourselves?
Hi, I'm Bob Bennett. I am the COVID-19 Vaccine Operations Director for Unified Government, and really happy to be here with my partner in crime, Dr. C again.
Hi, everybody. My name is Erin Corriveau, also known as Dr. C, and I'm the Deputy Medical Officer for the UG Public Health Department.
All right, so we got a couple things to talk about today. First one, we're going to talk about who is newly eligible for vaccines in Wyandotte County, and then we're also going to talk about some testing updates and saliva testing being available. But let's start with the vaccines. It's exciting that this week we were able to start vaccinating some folks who are age 85 and older. Let's talk about why we made that change. Dr. C, do you want to talk a little bit about that?
Sure, I can. We've worked on a certain strategy in Wyandotte County. We've really wanted to vaccinate those people who are essential workers. We know that this virus is being spread by young people who are out and about every day in the workforce. So we're trying to cover our bases there. We've done really well so far, I think, with very equitable distribution of our vaccines. We've worked really hard on that, but we also realize that our seniors are at great risk for getting COVID and then not doing well if they get COVID. And so we're ready now to open up to our 85 and older population. And as soon as we can, we're going to start lowering that age down to the over 65s. I'm going to kick to Bob there too and see if he has anything to add on that.
Sure, it's actually started this week with the seniors that we have aged 85 and older. So far this week, we've done about 300 of those individuals. We were very grateful that over 1,100 actually signed into and replaced their interest in our survey interest form to get the vaccine. And we are actually pulling from that list. So all of the things that we've been saying consistently since the crisis began with respect to fill out the interest survey, let us know that you're ready for the vaccine. We are actually using those, and that's how we're scheduling individuals to come in. And the really cool thing about the current population that we're doing, certainly a lot of folks in that 85 and older age group have additional needs for wheelchairs and other support access. Because we know they're coming in and we know how many are coming in each day, we're able to accommodate those needs. And we are making sure that every person in Wyandotte County who wants the vaccine is going to be able to get it.
Right, great. That's really good to hear. And I know I've heard positive feedback so far of folks who are 85 plus and have come through our site. So Bob, thanks for the work you and your team are doing at that site. And is it correct that we're starting with the priorities on the oldest adults within that group and moving through?
That's absolutely correct. We took all the interest forms that we had received, and we looked at all of them, and we placed the 85 and up into a bin. There, like I said, there were about 1,100 of those responses, and we've been working through that through the age of the individuals to make sure that we're, as Dr. Corvo was pointing out, taking care of those folks who are at the greatest risk for not doing well with this particular disease.
Okay, that's really good to know. But I want to remind folks as well, Bob, you all are still vaccinating those high contact critical workers as well.
We are. One of the things that the Kansas policy allows us to do is once you start a group like healthcare workers or post office employees or some of the high contact workers that have been coming through recently associated with the food industry, those continue, and you add on additional eligibility for new people as we work through the population. So this week we're seeing fewer postal operators and fewer KCATA operators, and instead we're seeing more folks who are seniors. Next week, I think we're going to continue to see more seniors and more from the food industry, but then we'll also start working into those categories, as Dr. C noted, in terms of who's vulnerable, who is it that we can make the most impact with this incredibly limited asset called the vaccine itself.
All right. Well, I want to remind people that if they're interested in getting the vaccine, especially if they're in that 85 plus age range, or if they're an employer who has workers who are eligible right now, you can go fill out our vaccine interest form. It is available online. We'll put the URL on the screen so you can see that. But we also know that not everybody has internet access. So you can call 311 to have someone help you fill out the form as well. All right, do you want to talk about saliva testing? It's a pretty exciting update that started this week as well.
We have some really exciting news about saliva testing. Our big testing site at 78th and State, which is also where we give the vaccines at this point, we're going to transition that site, instead of having the nasopharyngeal swabs up the nose, to just a saliva test. And this test is actually a spit test. So if you want to be tested for COVID, which we would absolutely encourage, go on in there and we'll give you a packet with a little vial. And what we would ask is that you give us a spit sample and then we'll send that off. We're still having really great success with fast results. So within about 24 to 48 hours, but closer to 24 hours, we'll be able to give you your result. And we hope that this will encourage people to come test more often. We're not having enough tests happening in Wyandotte County. And when we don't have enough tests, it worries us in public health because it's hard for us to keep track of disease transmission. And so again, I want to encourage everyone, if you're feeling even the least bit ill, please come in and pick up a saliva test packet and go ahead and do that test. If you've been in contact with anybody who may have COVID, come on in and get tested. Or if you just want to test for the heck of it, we'd also like to see you. You know, previously we had experimented with some of these swab tests, you know, and we were going to transition to swab tests full time. This is months ago now. But we ended up going back to the nasopharyngeal swab up the nose because we thought it was more accurate at that time. Now, this test that we're going to be starting with now, today, it's actually a much better test. And we think that it is similar in accuracy, if not the same, to the nasopharyngeal swab, which we think is kind of the gold standard test out there. Now, Dr. Greiner and I have pored over all of the data we have from both types of tests, and we absolutely believe that there's even 100% qualitative agreement between the spit test and the nasopharyngeal test. And so we feel really confident that this test is going to be a good one for Wyandotte and is going to give us accurate results. So if you've got COVID, it'll tell you if you've got COVID. If you don't have COVID, we have a confidence that it'll tell you you don't have COVID. So we hope, again, that all of you will come in and get tested. There's going to be a lot going on in the schools, in our businesses, even places where you pick up your groceries. You might get a test. We might have pickup sites here, there, and yonder around the county to make it a lot easier for you all to do testing. We're just encouraging everybody, please think about it. Give us a sample if you can. It'll help us keep track of COVID in our community.
So, Bob, can you talk more about, so we know how it works. We know that it is effective. We know there are going to be different options for people taking the test. But if someone shows up at our testing site at the former Kmart building, Monday through Friday, 9 a.m. to 3 p.m., they show up, they walk in our doors asking for a test. What happens then?
So an individual is going to walk through the door that says COVID testing. It's very clearly marked in multiple languages. You will enter onto a carpeted area where you'll meet one of our greeters. The greeter will issue you the package with the entire test kit in it that Dr. C referred to. The individual will then either go out to their car to provide the sample into the little cup, and bring it back into our building, which we'll then send out for testing and get it taken care of for you. Or there's even an envelope in there where an individual could, at their own leisure, take the time to do the sample at home where they're comfortable, place it in one of the mail systems, which allows the system to take the sample away, and then they'll get the results back. So it very much gives the authority to the individual to take responsibility for their own health and to help us to take care of the entire community as a whole. Because everyone is able to do things at their own pace and at their own schedule. And we're very, very pleased to offer it here and also to our new site when it opens as well.
That's really great that you can do this like in your living room when you have the time, and then when it's easy to be able to 30 minutes before not have anything to eat or drink or smoke anything in your mouth for 30 minutes before. And then as I understand it, there's like a FedEx label that comes with it, and then you can drop off your test at any FedEx drop box, which are
FedEx drop box in the Kansas City Metro, and you'll get the response back, as Dr. C was noting, very quickly within 2 days or so.
And like Dr. C was saying as well, we're hoping to have additional community sites where people may be able to pick up those test kits. That's still in the works right now, but as of right now, you can walk in the doors at our testing site at 78th and State to get one of these test kits.
And we will have you in and out the door in probably less than 10 minutes. We did over 90 of those distributed yesterday, and we're anticipating between 90 and 150 today.
All right, great. Is there anything else you want to add that we didn't cover yet today?
We're not open this Sunday because there's a little bit of a football game going on. Don't know if you're tracking that or not, but go Chiefs. We'll certainly be cheering for them here and hoping to put a banner up in the Kmart next week.
All right. I love the sweater.
I'm jealous, Bob, seriously. That's so cool. Go Chiefs.
Didn't get the dress code for today, though. Oh, well. All right. Thanks so much. We'll talk to you next week.
Bye, guys.